I agreed to the making of this video.
Hello, how are
Hi.
you today?
I'm good.
I'm Katie and I'm going to be your nurse today.
Okay.
Today we're going to discuss postpartum hemorrhages.
Oh, okay.
I see that you're pretty far along in your pregnancy.
Mm-hmm.
We're going to discuss the causes, risk factors, and some ways to prevent postpartum hemorrhage.
Okay.
Okay? Postpartum hemorrhage is a serious complication of childbirth that requires immediate intervention. Identifying risk factors is important in preventing postpartum hemorrhages and managing maternal well-being. A risk factor can be anything that increases the possibility of developing a disease or condition.
Okay.
You can have there are two different types of risk factors. There is modifiable and non-modifiable. There are 4 causes of postpartum hemorrhages that include uterine atony, which is the lack of contraction after you're delivering.
Okay.
Trauma to the birth canal,
Mm-hmm.
retained placenta, and thrombin or coagulopathy.
Okay.
There are certain risk factors for each of the 4 causes. Risk factors for uterine atony include women giving birth to their first baby, women who are pregnant with more than one baby, babies weighing more than 8 pounds, 13 ounces, or 4,000 grams at delivery, and the use of forceps or a vacuum to deliver the baby. Some risk factors for trauma include babies weighing more than 8 pounds, 13 ounces, or 4,000 grams at delivery, a fast delivery, a post-term delivery, which is a baby born after 40 weeks of gestation,
Okay.
a labor lasting longer than 24 hours,
Mm-hmm.
and maternal obesity. Now, risk factors for retained placenta include women who have given birth prior to this pregnancy, women who are pregnant and over the age of 34 years old, and induction and augmentation of labor. Risk factors for thrombin/coagulopathy include HELLP syndrome, sepsis, and amniotic fluid embolism.
Those sound very scary.
We can try to prevent postpartum hemorrhages by monitoring what medications you're taking. Pregnant women taking antidepressants, antiplatelet drugs, beta agonists, and aspirin are at higher risk for postpartum hemorrhage.
Okay.
Women who delivered by cesarean section should have their uterine artery clamped for at least a minute to reduce the possibility of hemorrhages. The last and probably the most effective prevention method of postpartum hemorrhages is immediate skin-to-skin after delivery with the baby.
Oh, okay.
As long as you and baby are safe, you can be put skin-to-skin right after delivery, even if it's a C-section.
Okay.
Skin-to-skin increases circulating levels of oxytocin in your body and helps your uterus contract.
Okay.
Do you have any questions?
I don't think so. I mean, I don't think I have to worry about any of the medications you're talking about, or
That's
I
good.
haven't seen any signs of anything strange going on, so I think I'm good.
And you're